Good morning. I'm Dr. Susan Ream. I'm Medical Director for the National Foundation for Infectious Diseases, and I'm joined by Aria Finger of DoSomething.org and Dr. Leslie Walker from Seattle Children's Hospital. It's my pleasure to welcome you to this news conference, which is devoted to discussing the results of a survey about perception of teen health and wellness. Thanks for taking the time from your schedules to participate in this forum. I'd also like to acknowledge that we have a number of people who are participating by webcast, and we welcome you as well. As a reminder, this webcast will be archived and it will be available on the NFID's adolescent health site, which is called adolescentvaccination.org. If you are participating in Twitter this morning, our hashtag is Teen Health. First, I'm going to provide a little bit of background before Ms. Finger and Dr. Walker speak about the results of the survey. You'll then have an opportunity to talk with them and ask some questions after their presentations are completed. Let me start by telling you a little bit about the National Foundation for Infectious Diseases, which is celebrating its 40th anniversary this year. NFID is a nonprofit organization dedicated to educating healthcare professionals and the public about the causes, treatment, and relevant to this news conference, the prevention of infectious diseases. That emphasis on prevention will be obvious this morning. Prevention is one of our leading tools in healthcare in general, not only with regard to infectious diseases, but with regard to many other conditions as well. We've had great successes in preventive care at a number of levels, particularly in childhood immunizations, in child care, and in care of elderly and older individuals. But when it comes to adolescent health, we have some opportunities for improvement. Many people aren't aware that the Society for Adolescent Health and Wellness, the American Medical Association, the American Academy of Pediatrics, and the American Academy of Family Medicine all recommend annual checkups for teens. Currently, 1/3 of teens do not have our annual visits. Healthy People 2020, which is an initiative of the U.S. Department of Health and Human Services, lists increasing the percentage of adolescents having an annual wellness exam as among its top priorities for adolescent health. So why should we focus on this? There are a lot of reasons, some of which are obvious, some maybe not so obvious. We know, for one thing, that healthy individuals do much better in their academic work. Another reason is that maintenance of things like vaccinations, keeping them up to date, talking about nutrition, and counseling adolescents about preventive care has a huge impact on health, not only immediately, but throughout adulthood. Let's flip it around. From the teen standpoint, an adolescent health visit offers the opportunity to talk about things that they might not get to talk about otherwise. Things like their sexual health, drug use, and even emotional issues are things that can be talked about in an adolescent health visit. One of the most important parts of an adolescent annual checkup is the opportunity for teens to lay a strong foundation for their health care as an adult. It teaches them that going for a physical every year, whether they're ill or they're healthy, is an important part of taking care of themselves. Their ability to make good choices as a teen increases the chance of being a healthy adult as well. As our nation renews its focus on preventive care and wellness, there's never been a better time to learn more about how we can improve health outcomes and health awareness among teens. After all, teens are our future. We need them to be healthy adults, and because in a few short years, they will be the ones who are teaching their children about health and preventive care. Because of our concerns about these barriers to teen health, NFID collaborated with Pfizer to convene a roundtable on adolescent health at the end of 2012. We invited key organizations which provided their perspectives, and many of them are represented here today. We're very grateful to all the roundtable participants, and I'll tell you at the end of the session a little bit about the outcomes of that roundtable. But we're here today to talk about another key component of our initiative, which is to better understand teen health and how to improve it. We conducted a national survey of over 2,000 individuals representing the 3 important constituencies in adolescent health and wellness. This survey was conducted online and was developed jointly by NFID and Pfizer, and it was conducted by Harris Interactive. The participants represented the 3 main groups involved in adolescent health. First of all, teens aged 13 to 17, parents of teens in the same age group, and a number of healthcare professionals, both pediatricians, primary care physicians, as well as other professionals like nurse practitioners and licensed practical nurses. I'm going to give you a few key findings, and then Aria and Dr. Walker are going to talk about this in more detail. So interestingly, about 85% of the parents said that they felt that annual checkups were important for children between the ages of birth and age 5. But by the time we asked them about their teen health and annual visits, that dropped down to only 61% saying it was important. When we asked teens about annual checkups, about 2/3 of them identified at least one reason to not get an annual checkup. So that was of concern. When we talked about perceptions about the most trusted source for health information, we got some interesting perspectives. The healthcare professionals we asked about this said that they thought that friends of the teens were the most respected healthcare source. About half of the healthcare professionals said that. On the other hand, when we asked teens, they said that they considered healthcare professionals their most important source. But that didn't make it any easier in terms of talking to the healthcare professional. About 40% of teens said they had trouble talking with their healthcare professional. Not surprisingly, most of the healthcare professionals surveyed said that having a parent in the room impeded conversation with the teen, and that's something that can be addressed. And then lastly, we talked a little bit about concerns about how healthcare today can influence health in the future. About 1 in 4 of the parents we surveyed said that they thought that healthcare today was not a strong influence on teens' choices and teens' health in the future. And the same thing was true. 1 in 5 teens said that they thought that their lifestyle choices today did not have a big impact in their future as well. So that was somewhat surprising. There is additional information and complete survey results available at the website myteenshealth.com. So we're going to look at these results in the survey from 3 perspectives today. And we are fortunate to have 2 experts to speak with us. The first to speak about how health matters to teens is Aria Finger, who is the Chief Operating Officer of DoSomething.org, one of the largest U.S. nonprofit organizations for teen activism and social change. Aria?
Good morning, everyone. Thank you, Susan. Thank you, NFID and Pfizer, for convening us here this morning. As she mentioned, I'm the CEO of DoSomething.org, and our whole focus is to get young people, middle school students, high school students, college students, involved in social change, volunteerism, and taking action around causes that they're passionate about. So why am I here? It's because we care about the exact same things. The young people that I work with every day, we want them to be happy, we want them to be healthy, we want to focus on their emotional well-being, we want them to live positive academic lives and be lifelong leaders. So these issues should be important to everyone in this room, on the webcast, and beyond. I'm particularly excited about this study because it includes the voices of young people, the voices of teenagers. We see so many studies that focus on parents, healthcare professionals, coaches, adults, and that is fantastic. We of course need that point of view. But until we include the youth voice and their perspective in something that is obviously affecting their life, and that's why this survey is so critical. I thought the most important piece of information from this survey was that 96% of young people agree that it's important or somewhat important to be in good physical health. 96%. That means we almost have all of them. They care about this. Moreover, 2 out of 3 teenagers worry about being healthy. And so with 2 out of 3 young people caring about this issue, part of the battle is done. If you look at that compared to parents, only 28% of parents think that their teenagers care about being healthy. So you have 2 out of 3 young people caring about being healthy, worrying about being healthy, yet only less than 1 out of 3 parents. It's really amazing to have that youth perspective, to see that these teenagers really care about these issues. And so I think we're fighting some misinformation. You see young people, they're thought of as lazy, apathetic. Let's give these teens some credit. They are smart, they are ambitious, they care about their future, and of course, part of that ambition and looking to the future is caring about their own health right now. So let's start busting some of these myths. We heard in the survey that 1 out of 5 young people thinks that their current health activities won't affect them in the long term. And that's contrasted to 1 out of 4 parents who think that their teens' current health activities won't affect their health in the future. So of course, we're not happy that 1 out of 5 young people don't see the long-term effects of what they're doing right now, because those are critically important. But that means that a full 4 out of 5 teenagers, a full 80% of these young people, do see the connection between what they're doing right now and the long-term health implications. I think that is fantastic. So I talked about why I'm here, because I care about these teenagers being lifelong, healthy individuals. But why are we all here? We're all here for the same reason, to ensure that these young people go to the doctor on a regular basis, get their vaccinations, are able to talk to doctors about the things that are important to them and affecting them on a daily basis. And so, in my opinion, the survey actually points to 4 exciting ways that we can all join together in this mission to make sure that teens are as healthy as possible. The first is, let's frame this issue in a way that is appealing to teenagers. The survey says that only 3% of young people don't do anything to improve their health currently. 97% of young people are doing something to improve their health right now, whether it's eating right or abstaining from alcohol, tobacco. 97% of young people are doing something right now. So let's focus on that. These teenagers are a diverse group, and they certainly care about different things. Let's find out what they care about. There might be a wrestler. He's trying to make weight, and so he cares about nutrition. Let's use that as a hook to get him to care further about health in his life. There might be a young person who hates cigarette smoking and has a campaign at her school to get rid of it. Let's use that hook to make her care more about health. There might be a young person who's stressed about the SATs, getting into college, and the normal rigors of teenage life. Let's use that to get them to care more about visiting their doctor and getting their vaccinations. Secondly, let's continue this myth busting. 82% of teenagers think it's very or somewhat important to go to an annual checkup. And 74% of young people think it's a good idea to go to the doctor even when they are healthy. I think a lot of people in this room don't like going to the doctor even when they're healthy. So again, half the battle is done. The hardest thing to do is change minds. And the good news is we have the vast majority of teens on our side right now, with 82% of them thinking it's a good idea to go to your annual checkup. Thirdly, this is my favorite, let's turn peer pressure on its head. Peer pressure forever has been used for so many bad things. Let's make it used for good. We saw that while it's not the #1 way teenagers look for health information, about half of them do look to their friends. So their friends are influencing what they do and how they think. Let's arm these smart, busy, passionate young people with the right information about teen health so they can pass it along to their friends, their siblings, everyone in their life. And lastly, let's go where these young people are. More than their friends, we also saw that 50% of teenagers turn to the internet. Let's make sure that we have reliable information on the internet, on websites that teens actually go to and actually want to visit, that is customized and tailored just to them. And then a full 67% turn to their parents or guardians to hear about health information. Long gone are the days when all teenagers hate their parents, don't listen to them, don't turn to them for advice. It's actually quite the opposite. 2 out of 3 young people do turn to their parents for advice when it comes to health information. Let's make sure parents know that. Let's make sure they know that they're such a valuable source of information for their teenagers, and then also arm them with the correct information so they can do something. Again, I'm thrilled to be a part of a conversation that includes the varied and diverse voices of teenagers, and I want to thank you guys so much for having me here today. I'm excited to hear from Dr. Leslie Walker.
Thank you very much, Aria. We appreciate your passion, and we want to carry on that forward and put it into the perspective of the opportunities for the parent, teen, and healthcare provider triad. We are pleased that Dr. Leslie Walker could join us today. She is the Division Chief for Adolescent Medicine at Seattle Children's Hospital. She's Professor of Pediatrics at the University of Washington School of Medicine, and she's also the immediate past president of the Society for Adolescent Health and Medicine. Dr. Walker.
Thank you, and good morning, everybody. I think this is a really wonderful topic. I'm very excited to be here and be able to just speak about teen health. As a doctor who has dedicated their life to adolescent health and working with adolescents, and as an advocate that has been a strong member and very active in the Society for Adolescent Health and Medicine, I think this is a very important topic that needs to be discussed. And let's go back a little bit. You know, parents of young children know and value preventive health care visits with their child's doctor or health care provider. There they can learn about what comes next. That's real exciting for them, how to keep their child healthy and safe, and they can get their vaccines at that time. But somewhere along the way, as the child gets older and parents and teens, have busy schedules, days, other things become more important, and they seem to go to the doctor less and less, and to the point where many teens only see a doctor when they're going for a sick visit or urgent care when something happens and they really feel they need to go. But because of that, a lot of parents lose the opportunity to talk to the provider about what they expect, what comes next, where their teen is in a development, and how they can help their teen live as healthy a life as possible. And this is really unfortunate because I think this is the most important time in life for someone to have a preventive health care visit. Adolescents develop many health behaviors during 13 to 17, 13 to 18, habits that will last a lifetime and habits that will affect their adult life as well. Things like how to eat healthy meals when they're on their own and whether they have a healthy body image or not, whether they'll choose alcohol, marijuana, or other drugs, whether they really do a good job in responding to stress in their lives. This is a time when they begin to make choices. Some of those choices are stressful. How are they going to respond to that? Whether they begin to express their sexuality in a safe and healthy way, and even whether or not they wear seatbelts. All those choices begin to be those that kids make on their own. It is also a time when parents aren't able to be present 24/7 to guide their child in their daily choices, and a time when teens are becoming more aware of their choices and the world around them and are driven to try new things, which is a normal part of their development. So you have a teenager that wants to try new things, that's able to, that has more autonomy and more ability to make their own decisions. You have a parent who may not know what comes next and what's important in adolescent development, and you enter in that the checkup, the healthy preventive health care visit. Prior to the teen years, it's a very wonderful time where parents and the child have a chance to talk to the health provider about their current status and what's going to happen as the new year begins. But in the teen years, this whole dynamic of what's happening should change. I really look at it like a triad. There's a parent, there's a teen, there's the doctor or healthcare provider. And all of those people really have equal status in that visit. Prior to that, a lot of times the healthcare provider and the parent do most of the talking, and the child kind of sits in back until it's time for their exam. But now they all need to come to the table as equals. Not only does the doctor have a relationship with the parent, but they need to renegotiate a relationship with the teen, one where the teen can speak freely and without judgment on their behaviors, with a level of privacy and expertise that can help them make changes or understand what their needs are when they're identified. This survey shows that teens look to medical providers more than their parents thought for accurate information about their health. While it would be easy to believe that teens just listen to their peers for advice on health issues, we know that's not the case. It's clear from the survey that teens really look to their parents for advice more than anyone else. And when health information is needed, they rely on their medical providers as an expert. It is important to note, though, that the triad of doctor, parent, and teen is a somewhat simplistic view of how things really happen. In the survey reported today, it really highlights the reality that a lot of kids not only rely on their parents, they talk to their peers, they may have a coach, a teacher, friends, other people that are relatives in their lives that give them advice on their health and that they look to. It is therefore really important for a teen to have a medical provider to help make sense of all the choices that are before them and the expected health benefits or risks of those actions. Another important point to make from the survey is that teens really do care about their health, with 66% stating they worry about their health. That's not always what's portrayed in the media, and not even parents are aware that this is important, with only 28% of parents thinking that teens worry about their health. Again, that's another moment for education of the parents on what's developmentally appropriate and what really goes on sometimes in the teen's mind. It's also clear that parents and teens tend to be concerned about the same things, but since many are not talking about these important issues, they do not know that they have the same concerns. The survey highlighted that weight, sexual health, mental health, and vaccines are not discussed with parents or guardians in up to 30 or 40% of teens, both of them reporting. This is concerning because all of these areas have evidence that if a parent or healthcare provider is aware of what's needed, they can get help to improve a bad situation or an illness. Another assumption that was debunked in this study that was also just mentioned, but bears mention again, is that teens rely on the internet for the information. And while it said that 50% look on the internet for information, it also said that the majority of them do not trust that information. The trusted sources were parents, by far, and medical providers. Again, highlighting the importance of the teen developing a relationship with a medical provider so they can truth the information that they see but don't always trust. There has been much research over the last few decades showing the need for adolescents to have private time with their health provider, even when the visit is for an acute ailment. There is still an opportunity then and at preventive health visits to reach out privately to a teen to see if there are other unmet medical needs that need to be addressed. Many teens will not access needed medical care if they do not have the option of privacy or confidentiality at every visit. Privacy and confidentiality are really two different things. Sometimes a teen has a concern, like maybe they found a lump, they don't know what it is, but they're embarrassed to talk about it in front of 2 or 3 adults in the room. And maybe they're worrying that they don't want to bother their parents about something like this. In that case, privacy is needed, or a serious problem may otherwise be missed. Sometimes a teen has a confidential medical need that they're afraid to disclose to their parents, and many times because they just don't want to disappoint their parents. And other times they're concerned about how their parents may negatively react. So again, the health provider needs a time alone with the teen and to bring out this serious condition. Otherwise, we know that kids will forego and not get care for those things. It is also developmentally important for the teen to learn how to access health care and get their needs met before they become an adult. This time alone can help to model good habits in getting health care and reinforcing that they can access and do a good job navigating the medical system. Lastly, I would like to comment on the survey result that stated that only 25% of parents and 20% of teens think that the behaviors that they do during adolescence don't have an effect on their adult health in the future. This is dramatically far from reality. It is good that most do see the connection between teen and adult behavior, but we must not forget the ones that do not. And sometimes even noting that there is a connection between adult and teen behavior doesn't mean that people understand there may be something to do to change it. This lack of making the connection from teen to adult behavior explains in part why some teens aren't accessing needed health care and why some parents aren't taking them. I think that if parents knew that in the teen years their kids will develop their own personal relationship with food, their body image, and these things will go on through life, and if they make good choices, that's fine. If they're unable to make good choices or feel good about themselves, it may lead to obesity, diabetes, unhealthy habits, eating disorders, and even lack of exercise. If they knew that most adults begin to develop their habits around their sexual expression and safety as teens, and if they knew that drug addiction is a disease of childhood that begins well over 60% of those during their teens, 60% of those that are addicted, their addiction began in their teen years. If they knew all these things, they might think differently about addressing unhealthy habits that they see in their teens. Western medicine has its limits, but what we do know that can help to prevent adult disease should be highlighted in the life course. The teen years are a critical time in health, habit development, physical and brain development, as well as emergence of some chronic diseases. There's evidence that having a preventive health care visit can make a difference. Having a strong health triad between teen, parent, and health provider can lead to an empowered teen and their parents knowing what comes next in development, how to really support a teen to be healthy, happy, and productive, and an emotionally mature adult as they age. Thank you.
Thank you very much, Dr. Walker. That was a great discussion about how young people's behaviors are influenced by a variety at multiple levels, by a variety of influences, including things like school personnel, community leaders, allied health professionals, and so on down the line, in addition to parents and healthcare professionals. Because so many sectors of society contribute to adolescent health, safety, and well-being, it's clear that a collaborative effort that engages multiple partners is really optimal. We recognize that some of today's attendees, both in person and on the webcast, were involved in the December 2012 roundtable discussion about this topic. You are our partners in this world around adolescent health. Through our joint efforts, we can promote a more comprehensive approach to improving health and wellness among this age group. NFID will be continuing to lead the effort by publishing a white paper on the subject of teen health this summer. The core of that document will be some of the information gleaned from the roundtable, from the teen health survey that we're discussing today, and it will also include the results of one-on-one interviews with key thought leaders in this area. This white paper will be available on NFID's adolescent health website, which is adolescentvaccination.org. Now, I'd like to use the remaining time to open the field up for questions. If you have a question here in the room, please raise your hand and we'll get a microphone to you. Please identify yourself before you speak with your name and affiliation. For those of you who are participating by the webcast, we'll also accept questions from you, of course. Just go ahead and type in those questions, and we'll have them read out loud on your behalf, and the speakers will attempt to address them. So I'd like to open it up for questions. Yes, ma'am.
Hi, I'm Donna Mazik with the National Association of School Nurses, and thank you. I have a question for Aria Finger regarding teaching, the going to where the teens are and where their parents are, and giving information and education. Is that education sometimes available for both the teen and the parents together, or do you see separating information for those two audiences as the best way to get that information to them and that education?
I think when you're trying to sort of reach young people and parents about health information, I think it sort of matters less whether the teens and the parents are together. I mean, as we've been discussing today, it depends what the content of that is. There are certain discussions that teens will be most likely had one-on-one, and so you want to make sure that you're careful about that sensitive information. That being said, if a parent and a teen are on a mall trip together on a Saturday afternoon, there's no reason why we can't hit both of those audiences with messages that are important to each of them. I just think it's really critical that we often have messages that are meant for adults and then just given to teens. And so as long as we craft the message so it's specifically for the teenager, they will be more likely to hear it.
Donna, the school nurses have been wonderful partners in this effort, and I wondered if you had any thoughts about what you've seen work in that regard.
I think a lot of times school nurses begin that connection because school nurses will listen. And for many teenagers, that's a really trusted place, ungraded spot in the school building, which is a plus. And oftentimes what school nurses do is send students to folks like Dr. Walker. We try to make the connection with healthcare providers and helping them to understand the role of preventing disease, not just treating something that you have already. So we do believe that school nurses have an integral part to play, and that's why we enjoy collaborating with you on this project.
Thanks, Donna. There is a question from the web.
Yes, we have a question from Lynn Bozoff of the National Meningitis Association asking specifically Dr. Walker if, in your experience, you get different kinds of questions or different perceptions between boys and girls when they come to annual checkups.
I do think, I think probably the biggest difference is with developmental stage. You know, you'll get very different questions from males or females if they're early adolescents, you know, 13 and younger. When they get a little older, the questions are different. As they start to mature a little bit, the questions become different. I think that all are concerned about body image, which sometimes we don't hear about with the young men. There's a lot of body image questions. There's a lot of concerns about sexual health. It depends on if they're alone or not. When they're alone, you get a wide variety of questions from both sexes. When they're with their parents, I would say that both speak very little.
Leslie, as an adolescent health practitioner, how do you manage on a practical basis the opportunity to speak with the teen by themselves?
Well, some parents will just excuse themselves, like we saw in the study. Other parents, I kind of talk to them about how it's developmentally normal and appropriate and needed for a teen to speak alone. And I've been doing this now almost 20 years, and I can count on one hand the parents that really felt that they didn't want to leave their teen alone. I think most parents, once they realize it's something appropriate that needs to happen, they're happy to have their teen begin to speak alone. And I think when the parents are able to give their concerns, then they're not as worried about letting their teen talk alone, and they're not worried something will be missed.
Do you make a point also of speaking with the parents alone, or is that's something that may or may not happen, I imagine?
That's a little tricky because I'm the teen's doctor or the teen's provider, and so you don't want the teen to feel that somehow when they talk alone they're going to disclose everything they said. So it's a little bit tricky. I make sure I'm with the adolescent alone. Sometimes if there's an issue and the parent and the teen can't sit in the room together, I'll ask the teen if it's okay if I speak to their parent, but that becomes a little tricky.
It's tough to manage. Thanks, Lynn, for your question. Anything else coming up on the web right now?
We do have another one. Second question is, what can parents do to encourage their teen to care more about their health and take a more active role?
I'd love to hear you both speak about that. What do you think, Dr. Walker?
It's a little bit of a hard question because I think kids care quite a bit about their health. Whether or not they make the choices that maybe those we think are healthy, they think they're making choices that are healthy for them. So I think a lot of times it's more communication between the parent and the teen, beginning to understand what each other's goals and beliefs are and what choices they're making. Because I very rarely see a teen that doesn't care about their health. The choices they make may not on the surface look like it for some people, but all kids are, I think, are making choices to be healthy, to be safe, to be happy, to be liked, to be accepted in their world. So I think the trick is more trying to connect to where they are and what they see is important and helping them to move that forward. I think that's a little more important than trying to get them to be healthy, because most kids are trying to be healthy.
Again, I agree with Dr. Walker that most teens do care about their health. I would say sort of two things. One is, while teens do see the impact of what they do now for the future, short-term effects can be much more important to them. If they know that something they do today will affect them this evening, tomorrow, in the next 2 days, that's much more compelling than it'll affect them in 50 years. So figuring out how to make that, to shorten that time frame so they can see the immediate effects. And then we've also actually seen great success with social norming campaigns. And so when you go to a teen might say, oh, none of my friends go to the doctor every year. But if you explain to them, no, in fact, 2 out of 3 of your friends go to the doctor every year, they see that this is something that is normal, that everyone's doing, and that they should be doing it as well. So both shortening the time frame so they see immediate effects, and also using social norms.
In terms of that immediate versus delayed effect thing, of course, from the infectious disease standpoint, I think a lot about vaccines, because that's the immediate effect is pain. The long-term effect is prevention of cancer, prevention of serious infections, that type of thing. In the framework that you talked about, how can we better manage that perspective?
I think with vaccines, it's obviously a difficult thing to do, because you are talking about something that's going to prevent you from trouble for the rest of your life. There are a few things. One is you can talk about how you getting a vaccine affects your friends. So we talk about herd immunity and how you being safe makes everyone in your community safe, which I think is really important. And then you can also attach extrinsic incentives to what you're doing. So if you get a vaccine right now, we will help someone else do X, Y, Z, we will give a donation to this person, we will do something that is different from the vaccine to help someone else, and that will make the teen see an immediate impact to what they're doing right now, which might hurt a little bit, but that they see the other thing they're doing is actually more impactful. Dr. Walker?
I would say, too, that kids can make the same kind of decisions about their health that adults can with the same information. You give them time, they listen to it. They want to be healthy, too, and I very rarely see kids did not decline getting a vaccine. They may say, oh, it hurts. Oh, no, can you help it not to hurt? But they don't say, well, I'm not going to get it. They say, well, this is important for me. There's a lot of them that actually affect their adolescence and their young adulthood that they need to get at that time, that can affect them at that time. And they're interested in that. They don't want to be at risk for getting infections that could be prevented. So I think they need to also hear what the risks and benefits are of the vaccines, and they can make a good, strong decision.
That's reassuring. Mm-hmm. Even things like diet and other habits have a little bit more immediate kind of focus to it. So, but it is that long term that we're really looking for as well, not only in terms of the health effects, but just the behaviors that it takes to get there. Jen, anything else from the web? If there are no other questions, we'll close out the formal portion of this news conference. We want to thank you again for your participation and hope that you found this information useful and informative. We're looking forward to continuing to work together to make a great impact on adolescent wellness and to ensure that teens are going to be useful and productive members of society. Thank you very much.